Hi everyone, happy Friday the 13th. Welcome to Mom Talks. We are here at the Women and Infant Center with the beginning of our new series, which is all about the fourth trimester. Many of you know I just had a baby girl back in June. I've returned back to work, and now we're going to be talking about what happens after you have a baby, because there's so much that goes into not just caring for a baby, but caring for yourself as a new mom. It's so important, and we really want this to be a resource for new moms as they're navigating these first couple of months after their new baby's born. So today I'm joined with Dr. Ebony Carter. She's one of our OBGYNs here at the Women and Infant Center, also a new mom.
Yes.
So remind me when your baby girl got here.
January, so it's 8 months old, almost 8 months old.
You all didn't see this, but right before we went on air, we were sharing
Baby pictures.
baby girl photos.
Mhm.
It was fun. She had some cute kiddos. So we're going to start by talking about this phenomenon known as the fourth trimester. You hear 3 trimesters of pregnancy and then you're done, right? Wrong. So what is the fourth trimester?
So the fourth trimester is the forgotten trimester. It starts immediately after you have the baby. The postpartum period can last for about a year. So 6 months in this country tends to be when you go back and see your doctor, and we consider that the end of the postpartum period. And that's not true. So the fourth trimester really is to bring focus to the fact that that's when moms actually need, in some ways, the most support after the baby gets here.
Absolutely. Well, when you think about the newborn stage, the first 3 months, so you're thinking about the baby, the sleeping, the breastfeeding, the diaper changing. Why is this fourth trimester period, those first 3 months, why are they so important for mom?
So I think it's important for mom from a physical, a social, and a psychological standpoint. So physically, the body is going through a lot of changes and a lot of hormone shifts. You're still having heavy bleeding, trying to adjust to breastfeeding and milk coming in, especially if you decide not to breastfeed and the engorgement that happens with that. Your uterus when you deliver a baby is about the size of a watermelon. A normal uterus is the size of a chicken leg, so it has to go from being a watermelon and contract back down to that chicken leg.
That's crazy to think about, isn't it?
Yes. And so the body is going through lots of physical changes and the healing. So if there was a vaginal laceration or a C-section. Also peeing and having bowel movements can be very challenging after you have a baby. So that's physical. Socially, you have brought this new little person into your life, into your family. And while that is wonderful, bringing a new person into your household is also stressful. So all of the family dynamics and the changes that happen, and also dealing with going back to work. So unfortunately in this country, moms go back to work. 20% of moms are back to work in 10 days.
Wow.
Another 20% are back in 10 to 40 days. So that can be challenging. And then you go to the psychological, and with hormone shifts, and especially if people were prone to depression or anxiety or some of those things before having a baby, a newborn does nothing to help any of that. So mental health can also be a huge issue in this fourth trimester or postpartum period.
Before we get too far, I do want to say, new moms, new dads, anyone who might have questions out there, we are here to answer your questions. So she said, physical changes, emotional changes, social changes. If you've got questions or you want to hear a little bit more, we're going to be going through all of these, but if you want to hear a little more, go ahead, type us your question. We'll get to it through the episode. Also, you can always come back, watch this later, and get some of the answers that you might be, to the questions you might be asking. So we were talking, we'll start with physical changes. For starters, I heard a statistic the other day that 40% of women actually do not attend their postpartum visit. This is the 6-week visit. I kind of thought of it as kind of the closing the book of the pregnancy. Baby's here, final checkup. So why are these visits so important for women?
So for a few reasons, and I think part of the fourth trimester push is saying that the 6-week mark is not the end. In some ways it's the beginning, but that tends to be the final time that you see your obstetrician. So it's important for a few reasons. Number one is what's happening with your body, and is it normal? So I think a lot of women have trouble with incontinence, where you're losing pee if you cough or sneeze or laugh, and people are too embarrassed to say that. So I always ask, how is peeing? How is pooping going? How are you feeling emotionally? How is the baby feeding? Is breastfeeding going okay for you? Are you having any difficulty? Some people who aren't breastfeeding have difficulty getting formula and enough formula. So all of those kinds of issues. How is your bleeding? So there can be complications with pregnancy, such as a retained placenta or those kinds of issues. We should be capturing all of that information at the 6-week visit. The other thing is pregnancy intention. What is your vision for your family? Do you want to have more kids? What is the time frame of that? And so we talk about contraception. How are you doing from a mood standpoint? You can see it's a really busy visit. We go through a lot of information. And the other thing is if a mom had chronic medical problems, when you lose all of that weight and you have all of those fluid shifts after having a baby, medication doses often need to change. Or did you have high blood pressure? And your primary care doctor should know that. So I think another little known fact that I want to use this as an opportunity to talk about is if you have a preterm baby, a little small for gestational age baby, or diabetes in pregnancy, or a blood pressure issue in pregnancy, your risk of having a future heart attack, stroke, heart disease is increased significantly. So it's really important to understand those risks and be bridged back to your primary care doctor. So 6 weeks might be the end of your care with your obstetrician. It should be the new beginning of your care with the primary care doctor, and making sure we are getting all that information back to the primary care doctor to make sure mom has what she needs. Also vaccinations. Are you up to date on vaccinations? Because, for example, measles, mumps, rubella, you can't get that in pregnancy. So if you weren't immune, we should be making sure that you've had all of those things, pap smears. So we try to really tie up all of those healthcare issues at the end of the pregnancy.
And I know a lot of these questions, they might be hard for new moms to talk about. I mean, who wants to go in and be talking about peeing or pooping or things like that? But again, these are all things that are complications from being pregnant and being postpartum that, they really just need to get talked about.
Yes, and there's solutions. So, pelvic floor physical therapy, I think most women in France have pelvic floor physical therapy, and that can actually really help with some of these peeing issues in particular. So we try to bridge people not just to primary care, but to the other services in the community, mental health services also, that can really help a new mom and her family to thrive.
So let's talk about, I know one big component of a postpartum visit is talking about contraception and talking about what's, the future of your family like. Why is it so important to, have that plan already in place, or be thinking about that plan so quickly after your last baby?
So we want to make sure that pregnancy intention is important and planning pregnancies. And a quick pregnancy after one increases all of the risk for complications like preterm birth. So you really don't want to have another baby within 6 months of a pregnancy. And there's some data saying that even up to 18 months is going to give you better pregnancy outcomes. So we try to make sure that contraception, if a woman wants it, she's able to get it at that point. Primarily because pregnancy spacing is important for pregnancy health.
Looks like we have a question actually about that.
Yeah, one of our viewers is asking how soon after birth or after giving birth is it possible to get pregnant?
So I was telling them as we were talking here, the earliest that I've ever seen is I had a patient once come back to her 6-week visit and she was pregnant.
Wow.
So my answer is soon.
So, and you were talking about birth spacing, but it's really the ideal to wait, you said 18 months.
So a minimum of 6, and there's some data supporting up to 18.
Okay, so one nurse once commented to me, this is the visit the husband's like because it means that you're cleared to have sexual intercourse again. Why should you wait until your postpartum visit?
So I'd say, and even for 6 weeks, I'd say not necessarily.
Sure.
Because every situation is individualized. So after having a baby, a vaginal delivery, people often have vaginal lacerations that are where the vagina is sewn up. So you need to wait and give the vagina time to heal. Women who've had a C-section, we act like a C-section is nothing. It's major
nothing.
Abdominal surgery that you have to heal from. And by the way, when you normally have surgery, you go home and somebody's taking care of you. You've had major abdominal surgery and you're taking care of this little person who requires everything of you. So first of all, the body needs time to heal. And sometimes I will look at a laceration at a 6-week visit and say, this isn't quite where I think that it needs to be. Like we should actually hold off a little bit longer in terms of intercourse. So I think the major reason is healing, and then also we don't want moms to get pregnant during that period, and so that she's actually making conscious choices in terms of pregnancies.
Absolutely. So I know one thing that always comes up is breastfeeding and making that decision. And just so everyone out there watching is, we are going to be doing a topic later on in this series about breastfeeding, about pumping, about formula, about you name it, we'll get to that. But I do want to talk about it here in this episode a little bit because it's always the question that gets asked, how's breastfeeding going? Why is that such an important part of the visit?
So first of all, making sure that the baby is getting the nourishment needed to grow. So you kind of freak out as a new mom because most babies lose weight in those first few days, and that's always a little bit disheartening. And so first of all, we just want to make sure that the baby is getting the necessary nourishment. The other thing is, one of the major things that I find new moms really upset about when I'm doing postpartum running in the hospital is breastfeeding. You think it's going to be this beautiful, wonderful experience, and it is. But that's not what it usually looks like in the first few days. It can be frustrating as the baby latching. I found it personally pretty painful initially, and I'm glad that I persevered through that because it became wonderful, but your breasts are not used to being sucked on every couple of hours. Like, it can be a bit uncomfortable. And one of the things I will say, I had all 3 of my children here, and the lactation consultants were absolutely amazing.
They are.
There was one day I was visited 4 times that day by a lactation consultant because there are some tricks of the trade that can be helpful. So I'd say one is baby's nourishment, and number 2 is mom's psychological health. I think we have all these expectations, like I'm going to breastfeed, and when it doesn't go well, it almost feels like you're a failure. So just remembering that is best.
Absolutely. Yes, I know that follow-up was nice. I also delivered here, and I do want to give the plug. Yes, they were wonderful, but to have that follow-up in the hospital and then 6 weeks later to just, get your questions answered, because questions come up during that 6-week period when you're home for the first time. So I want to talk about a big topic you hear a lot about is postpartum depression. What are you looking for with a new mom coming in emotionally? What are you watching for?
Sure. So I think postpartum depression is good, but I actually want to back up a little bit and talk about baby blues, because more than 80% of moms have baby blues. And it can kind of be this feeling of being super tired. Who wouldn't be when somebody's waking you up all night long? Feeling a little bit sad and just like, a little bit down in those first few days. So baby blues tends to happen within a few days of having the baby. It peaks a few days after that, and usually it's resolving within 2 weeks. So I'd say that that's not abnormal, and the vast majority of moms have baby blues. Postpartum depression is extending past that 2-week period, and it can be some of those same baby blues symptoms, but kind of more and more severe. So, difficulty sleeping, which I think goes along with being a new mom, decreased interest in things that you used to be really interested in, or even decreased interest in the baby, feeling guilty or somehow like inadequate. And like I said, these are often common new mom symptoms, so it's kind of like an exacerbation of them. Difficulty with concentration, appetite. These are all kinds of things that go into postpartum depression. So I guess I would stress severe and lasting longer than that 2-week period, and up through like the 1 year postpartum period can still be postpartum depression. So I'd say if any of these symptoms are happening, I would always err on the side of reaching out for help. The obstetrician is a reasonable place to start, and we are screening for that in postpartum visits as well.
So it looks like we have a question.
Yeah, one of our viewers is wanting to know, how is postpartum depression treated?
So with a combination of things. So I will say here at Barnes, we have a perinatal behavioral health service that continues to see moms up to 1 year postpartum, and they're amazing. And so in conjunction with the obstetrician, it's a combination of therapy can be very helpful, support groups, and if needed, medication can also be helpful for treating it.
So when a mom comes in at 6 weeks and you talk to her about postpartum depression, what kind of goes into, I remember at one of my visits I took a quiz, so what kinds of things are you specifically looking for?
So I asked for some of those symptoms that we just talked about, and then we always do the quiz you talked about is called the Edinburgh Depression Scale, and so we ask all moms to fill that out. And that scale is really good for flagging moms where postpartum depression might be an issue, where we're going to dive a little bit deeper to make sure that she has the support that she needs.
So the best place is to reach out, come here, or to, reach out to a primary care physician and talking about it. One thing I've also heard about is moms saying, I'm having trouble bonding with my baby. Is that common?
Which can also be a symptom of it. So one other thing that I want to bring up with postpartum depression is the time to start preparing for it is before the baby is born. So moms who've struggled with depression ahead of time, or moms who have a preterm baby that's in the intensive care unit, or if you had a birth experience that just was not what you were expecting, and maybe it was even traumatic and scary in some way, we know that those are things that set moms up for postpartum depression. And so with the help of our colleagues in the perinatal behavioral health service, we start planning for that back when mom is still pregnant, just to know this could happen, and there's lots of support here for you if it does, and you're not alone.
Right. I've heard increasingly about that is, having a traumatic birth experience, or, unplanned C-section, things just, some people are more planners than others, and, and if it doesn't go that way, it can be really hard. Or NICU stays. There's all these things that can factor into postpartum depression.
Well, and I think it's also appropriate to say, as we're on Facebook right now,
Sure.
Facebook, I think, does not help us, because you see these beautiful newborn pictures and people look so happy,
Right.
and people are putting the best of it on Facebook.
Absolutely.
So the fact of the matter is, as new moms, it's a stressful experience for all of us, and you're seeing the best of it, and that's probably like less than 10% of what's actually happening.
There's a reason Instagram has filters. I have to say, I'm guilty of that, of posting my beautiful daughters, but people don't see, I always use the word overwhelmed, when I talk about how I was feeling in those first couple of months, just 2 kids, a new life, and a new way of doing things.
And they can't communicate.
Right.
So it's the person who matters more to you than anyone in the world. You want to do right by them, and they're just crying, and you just want to say, what's wrong with you?
Use words, but you can't use words.
Right.
So when you have moms come into your office, and maybe they express something like, I just said, it wasn't necessarily a depression, but a feeling of being overwhelmed, of a newness to this whole situation. What do you kind of say to moms to, encourage, to give support, those kinds of things?
So I start off by trying to provide some reassurance that Facebook isn't reality.
Sure.
And we've all been there, and I think that is the norm, to feel a little bit anxious or not knowing exactly what to do, and that you're not alone, and that there's a lot of support. So helping people to see the support that's around them in their community, and then also the support that we can offer here to help them through that period.
And, I know one pediatrician said to me, she said, it's going to get better. And she was right, she was right.
I actually feel like for each of my children at their first birthday, it was almost like a fog had been lifted. Like, I felt like I was fully functional again. I was thinking straight. But I mean, it takes a while to incorporate a new person into your home.
So, my daughter just passed her 3-month mark. So I am just kind of coming out of this 4th trimester stage. And yeah, you're absolutely right. Where every child is different. Every experience is different. This might be the second time around for having a new baby, but the first time, that my older one became a sibling. It's the first time I have 2 hands for 2 kids now, as opposed to both hands for 1 kid. So it's just a new set of challenges every time. So some that, presented at the first child, some that are brand new. And that's what the series is really going to be about, is navigating the different ins and outs of having a newborn, and what it's going to be like as a new mom. So next week, we're going to be at our Safety Stop location at St. Louis Children's Hospital, and we're going to be talking about safe sleep. Obviously, big topic, always big topic, as far as keeping your kiddo safe in their crib. Where should a baby sleep? Should they sleep in your room? Should they start out in their own nursery? What's the deal with co-sleeping? Is that okay? Blankets, stuffed animals, they're cute, but should they be in the crib? So we're going to answer all of those questions and much more next week at 11 o'clock right here on Mom Talks. Thanks for joining us. We'll see you next time.